Good morning, everybody. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be covering 60 practice questions to help you pass your CNA examination. So happy Saturday. I'll give you a few moments to receive your notifications, and we will get started shortly. So I have great news for you all. On Saturday, December the 28th, so the upcoming Saturday, I am having a free online vision board party. And I think that writing your vision, making it plain is so important. A lot of you all have aspirations to earn your CNA license, to start nursing school, or to finish nursing school, plus all of the family dynamics, etc. So I hope that you join me online. It is free to attend at 6:30 p.m. on next Saturday, and we're going to help you write your vision board. And best of all, I'm going to be your accountability partner to make sure you can achieve those goals that you write down to start at the start of 2025. All right, so question number one, team. Good morning, everybody. Question number one, which of the following suffixes means lack of strength? Is it algia, tomy, asthenia, trophy, or phasia? Which one means a lack of strength? And I'll reveal the answer in 5, 4, 3, 2, and here is the correct response, team. Asthenia. So I saw that somebody wanted to choose trophy, but trophy is the lack of muscle. So asthenia means weakness or lack of strength. Question number 2. This one's the easy one. The body cavity that contains the intestines is the A, thoracic, B, spinal, C, abdominal, D, pleural, or E, peritoneal. Which body cavity contains the intestines? And I'll reveal this answer in 5, 4, 3, 2, and you are right. It is C, it's abdominal. So the intestines are located in the abdominal cavity, which contains many digestive organs. Question number 3. Let's see if you know your medical abbreviations. The abbreviation QOD, as used in prescriptions, means A, every hour, B, every 2 hours, C, twice a day, D, 4 times a day, or E, every other day. Revealing the answer in 5, 4, 3, 2, and looks like I have one correct response so far, 2 correct responses, Marlon and Sarah. Yes. So it is E. QOD is every other day. The pacemaker of the heart. And if you've not taken anatomy and physiology, this one may be a little bit hard for you, but I promise the rest of the questions are a little bit easier. So the pacemaker of the heart is the A, septum, B, SA node, C, AV node, D, left atrium, or E, mitral valve. So imagine you as a new CNA and you're hearing all these terms. It is okay to open up your book to ask your nurse, hey, what are you talking about? The pacemaker of the heart. And the way I like to think of the pacemaker of the heart is the party starter. It is the BSA node. So the SA node, if the SA node is malfunctioning, the party doesn't start, the heart rate won't be fast enough. So the SA node is the heart's natural pacemaker that initiates electrical impulses. So when we say someone has bradycardia, their heart is slow, is beating slower than normal, more than likely there is an issue with the heart's electrical system and that the SA node is either being bypassed or not functioning properly. Irene, congratulations, my dear. I am so proud of you and thank you for coming back to let us know that you passed your test. Everybody tell Irene congratulations. All right, so question number 5. This one's going to be easy for you all. Which of the following suffixes refers to pain? Is it phagia, dysys, nia, algia or lysis, which refers to pain. Revealing the answer in five, four, three, two, and I see so many correct answers. Yes, it is D, algia, as in neuralgia or nerve pain. Question number 6. The nursing assistant notes that a client's respiratory rate is 0. Uh-oh. The nurse aide should A, resume the client's normal care, B, wait 10 minutes and check the client's respirations again, C, inform the client's family that the client is dead, D, contact the charge nurse immediately. What do you think the best response is? And if you chose D, you are absolutely correct. You need to contact that charge nurse because if this patient is a full code, we're going to begin resuscitative efforts. So a respiratory rate of 0 indicates the client is not breathing and requires immediate reporting. Right, and so I see a lot of you all in the chats. If you would do me a huge favor and let me know where you are viewing from. Also, let me know where you are because I see like Marlon is getting all the answers correct. I see you, Mrs. Love of God, Regina, Marie, and a Kay. Where are you from? And are you in a CNA program? Are you going to nursing school? Put that in the chat so I can learn more about you as we finish our test today. And today we have 60 questions. So question number 7. After a client dies, the client's spouse wishes to share his emotions. The nurse aide should A, listen and try to provide comfort. B, change the subject. C, tell the spouse to contact a counselor. D, send him to the charge nurse. The spouse wants to talk. What do you do? How do you show empathy? And yes, Regina and Charlene and Adiola and Marlon from Saudi Arabia. Yes, great. Welcome. So you all, for question 7, it is A. You're going to listen and try to provide comfort. So remember when you're taking your CNA or your PCT examination, the patient care tech is the hospital level of a CNA. Whenever you are communicating, active listening is important. So providing emotional support is a part of compassionate care for grieving family members. And Danita's from Detroit. Welcome, Danita. All right, question number 8. An example of a special device to help prevent contractures is it A, hand roll, B, Doppler, C, mattress, or D, manometer? How do you help prevent a patient's from contracting, from their body turning inward, from a joint becoming fixated? What is a device that we can use to prevent contractures? Yes, Charlene and Sarah and Anna Kay, it is a hand roll. So a hand roll, so the answer is A. Hand rolls help to maintain hand and finger alignment, preventing contractures. And if your facility doesn't have hand rolls, don't forget you can always roll a washcloth and put that inside of the patient's hands to prevent those fingers from just curling in. And don't forget to do range of motion exercises. That will help also. And then Regina, looks like you're in South Carolina. I hope I understood that correctly. Welcome. Question 9, falsely stating that a coworker took a client's money is an example of negligence, assault, defamation, or hoarding. And we'll reveal the answer in 5, 4, 3, 2, and team has it. It is C, defamation. Defamation involves making false statements that harm another person's reputation. Question 10, hemiplegia refers to A, paralysis on one side of the body, B, paralysis of both legs, C, paralysis of both arms, or D, paralysis of all 4 extremities. And Regina's from Newark, New Jersey. It is cold here, Regina, and I'm in Florida. It's like 40 degrees today, so I can only imagine what the weather's like in Newark. All right, everybody. So question number 10, Sarah says A, Marlon says A, Marie says A, and I'm revealing the answer in 3, 2, and You are correct. Paralysis on one side of the body refers to hemi, which means half. Plegia means paralysis. And so you'll usually see hemiplegia after a CVA or a stroke. Question number 11. The most accurate method of measuring body temperature is A, rectal, B, oral, C, axial, or D, feeling the forehead. What is the most accurate method? And everyone has it correct. It is rectal. And remember, whenever you're performing a rectal temperature, you do not put that probe all the way into someone's rectum. Usually just the tip, the metal portion is all that you would place and make sure that it's lubed. But the rectal temperature measurement is the most accurate because it reflects the body's core temperature. All right, so I'm going to give you time to read this one. It says, which of the following sets of vital signs should be reported immediately? And this is a lot to read, so I will give you about 30 seconds to select your response. 20 seconds left. 10 seconds left. And we'll reveal the answer in 5, 4, 3, 2, and I see you all were torn between A and B. And so in your facilities, you usually only report something if it was abnormal. So even though in A, the pulse is 60, that is low, but it is low normal. So for A, there is nothing urgently that you need to report. However, for B, the temperature is 102.4. The pulse is 100. The respiratory rate is 32, and the blood pressure is 180 over 100. So this person has a fever. They are breathing fast, so they have tachypnea, and then their blood pressure is high, so they are now hypertensive. And so these vital signs are the ones which are the most concerning. And so if you chose B, give yourself applause because you need to get that nurse in the room right away. Question number 13. Ooh, time for some math. A client consumed 180 cc's of tea, 60 cc's of soup, and 120 cc's of ice cream. What is her total fluid intake? Is it 180 cc's, 240 cc's, 300 cc's, or 360 cc's? And usually for your CNA examinations, you won't have a whole bunch of mouth questions because they typically don't allow you to have paper and pencil there. And so they may ask you for like the formula, but rarely will they just be like, okay, we need you to do math without pen and paper. What's the answer? So if you need time to get pen and paper or use your phone's calculator, you can do so. You have about 10 seconds left to give me the answer to question number 13. All right, revealing the answer in 5, 4, 3, 2, and everybody got it right. It is D. It is 360 cc's. And don't forget that what goes in should match what comes out. So if a patient had 360 cc's of liquids with breakfast, whenever he or she goes to the bathroom, you need to see an equivalent amount of urine. Okay, so if they are not urinating and they're drinking, that means they are retaining it, and that's going to cause some additional medical concerns. Question 14. A client is placed on strict INO after surgery. The nurse aide should A, keep the patient NPO, B, record the client's entire solid food intake, C, record the client's fluid intake only, or D, record the client's fluid intake and urine output. What does strict INO refer to? All right, revealing the answer in 5, 4, 3, 2, and you all are correct. It is D. So we're going to record the client's fluid intake and output. So strict INO involves tracking both fluid intake and output to monitor hydration and kidney function. And don't forget bowel function. So again, what goes in should match what comes out. So if a person is eating breakfast, lunch, and dinner, and they haven't had a bowel movement, well, that's going to pose a problem in a few days. So you want to make sure that your patients are at least being asked the question of when was your last bowel movement, so that we can hopefully prevent constipation and get their bowels moving more regularly. Question 15. Which of the following would be included in a client's output record? A, urine, food eaten, and IV solutions. B, urine, emesis, and bleeding. C, liquids taken in during the shift. D, bowel movements only. Which of those would be included in a client's output record? Hmm. All right. Gail says B. Marlon says B. Any other responses? Revealing the answer in five, four, three, two, and if you chose B, you are correct. So, B, urine. Emesis is the medical term for vomit. Remember, output, what's coming out of this person's body. We have to measure their vomit, their emesis, because if they have more coming out than they have going in, they're going to be dehydrated. And bleeding. How do you monitor bleeding? Where post-op, they'll usually have a surgical drain, like what you see there on the screen, and you would disconnect it. Of course, they're going to teach you how to do this in your facilities. You'd have your gloves on, and you would empty that bulb. You would squeeze the blood out. You would then reconnect it, of course, keeping the bulb compressed. And that suction is going to evacuate that cavity, pull that old blood out. So output includes all bodily fluids expelled, such as urine, vomit, or emesis, and blood loss. And you would be documenting all of that. Question 16. Which of the following is an intake and output problem that the nurse aide must report? A, the client states that he is not hungry. B, the client requests a bedpan. C, the client has not voided in 8 hours. Or D, the client's 8-hour output is 600 cc's. And Kimberly from Mississippi, good luck on your test next week, my dear. All right, so which one should be reported to the nurse once you find this information out? And I do see where some of you all are torn between C and D. But if we have a person drinking and we want what goes in to match what flows out, 600 cc's in an 8-hour period isn't the worst, okay? Because that means they had breakfast and more than likely lunch, at least within those 8-hour window. So I would monitor that to see if it increases. But if a patient has not urinated in 8 hours, regardless of their situation, whether they're NPO, whether they are drinking, that is going to be a medical concern because the body usually produces about 15 to 30 cc's of urine per hour. So if a person has no urine in 8 hours, C is the correct response. Not voiding is a potential sign of urinary retention or dehydration and must be reported. So if this person is retaining urine, we're going to do that bladder scan, and then a bladder scan is going to let the nurse know whether or not the person needs to be catheterized. And that's why you will sometimes see a patient with a catheter, is because they are retaining urine. Question 17. A client's water pitcher holds 500 cc's. The pitcher is full at the beginning of the shift and empty halfway through the shift. The nurse aide refills it, and the client drinks half of the pitcher by the end of the shift. What is the total intake for the client at the end of the shift? Oh, this one's hard. Is it 250 cc's, 500 cc's, 750 cc's, or 1,000 cc's? This one is tricky. Remember, we started off at 500 and it was empty halfway through the shift. And then you refilled it. So, with that in mind, give me a new answer. You refilled it, and then he drank half of the refilled pitcher. Revealing the answer in five, four, three, two, and it is C, 750. So the client drank the first full pitcher, 500 cc's, and half of the second pitcher, which would have been 250 cc's, for 750 cc's total. So yes, when you're giving the patients cups, you can say like, how many cups of water did you drink? But if you know that you physically filled that pitcher up and that pitcher is now empty, that's 500 cc's. And if you fill it again and now it's half empty, that would be another 250. And that's how you would document throughout your day. Question 18. A nurse aide finds a damaged piece of equipment. The nurse aide should A, dispose of it immediately, B, use it until new equipment arrives, C, report it immediately, D, repair it herself and then use it. Girl, you're doing too much. Above your pay grade. Don't be repairing their equipment. So revealing the correct response in 5, 4, 3, 2, and yes, we're going to report it. We're going to tag it, get it out of the room, put it in the supply room where the items that need to be addressed would be held. And so damaged equipment can pose safety risk, and it must be reported so it can be repaired or replaced. Question 19. After caring for a confused client, the nurse aide fails to pull up the safety rails, and the client falls out of bed and fractures a hip. This is called A, abuse, B, negligence, C, battery, or D, assault. And we writing you up. How did you forget to pull the rail back up after the person had a hip fracture? Oh my God. Oh, they have the hip fracture after you because you let them fall out the bed. So don't be that person. All right, everybody, revealing the answer in 5, 4, 3, 2, and yes, Hallman and Solange and Sarah and Sherlyn, it is negligence. It is B. So negligence occurs when a caregiver fails to take proper precautions, leading to the harm of the client. Question 20. A nursing assistant is giving foot care to a resident. What should he not do? A, remove corns. B, soak the resident's feet in water. C, check for skin breakdown. Or D, clean under the toenails using an orange wood stick. I'll take 2 answers for this one. Revealing the answer in 5, 4, 3, 2, and everybody has it right. So you do not want to try to act as a podiatrist and start removing corns. So we don't usually do any cutting or clipping. So if that is something that you're doing as in your role as a CNA, you're stepping outside of your scope of practice. So removing corns or calluses beyond the scope of a nurse aide's practice and should be done by a licensed professional such as podiatrist. We usually don't clean beneath their toenails either. That would be something that I've never done in my 26 years of nursing, is clean beneath someone's toenails. If I'm seeing they're having a toenail issue, I'm going to consult a doctor, aka I'm going to call the podiatrist. And so if you see something wrong with someone's toenails, you would notify your nurse so she can get a doctor in to evaluate it. And Mila says, are we ready for Christmas? I'm ready. Every day is Christmas. We just love on each other, and it's going to be a quiet Christmas. So I'm ready for it. And I hope you all are also. Question 21. When restraints are in use, the nurse aide should report all of the following except A, the type of device being used, B, the time the restraint was released, C, unusual observations about the client's skin, D, the nurse aide's experience with restraints. So we have somebody in behavioral restraints. We literally have to check on them every 15 minutes. You have to document every 15 minutes. You're documenting everything except for which of these responses? Yes, Jacobus. Yes, yes, Marie, it is D. We don't care about your experience. We just trained you. So, your experience is least important. The fact that you're monitoring this patient, doing vital signs, making sure they're breathing, checking circulation, that is what's most important. So, the nurse aide's experience with restraints is not relevant to the care or condition and does not need to be reported. We don't need to know that you're a new CNA and this is your first person ever in restraints, because before we gave you that patient, we had you do an in-service on restraints, how to properly apply them and monitor the patient. Question 22. The pulse located in the neck is called the, is it A, apical pulse, B, femoral pulse, C, radial pulse, or D, carotid pulse? The pulse located in the neck is called. Revealing the answer in five, four, three, two, and congratulations, team. Great job. It is the carotid pulse. So it is D. The carotid pulse is located in the neck and is often checked during emergencies. So, as a professor in the simulation lab at some of the colleges of nursing here locally in Jacksonville, Florida, whenever you all do an assessment, it's so funny as a student nurse, you all would check the patient's carotid pulse, even though the person was talking to you. So you usually don't check the carotid pulse if a person is awake, alert, and oriented. You check the radial pulse, the pulse that's in the wrist. You check the neck pulse when the person is unresponsive in the emergency situation because it is closest to the heart. And if the person still has some circulation, that would be the easiest place for you to detect it. Question 23. A client complains of numbness on one side of the body. The client's grip is weak and speech is slurred. The nurse aide should A, call the doctor because the client had a CVA, B, check the blood pressure to verify it is a CVA, C, check the client later to see if it may be a CVA, and D, report it to the charge nurse immediately because it may be a CVA. And if you don't know what a CVA is, it is cerebral, which means brain, vascular accident. It's the medical term for a stroke. So when do you want to report that you suspect someone is having a stroke? Yes, everybody, it is D. You want to report it right away. And so there are classic signs, or excuse me, those were classic signs of a stroke: the slurred speech, the weakness on one side, and immediately reporting it can save that person's life. See, I thought I missed a question. All right, so let's go. Question 24. When providing perineal care to a female patient, it is important to wash from the front to the back to avoid spreading bacteria found in the residents. A, pancreas, B, vulvus, C, meatus, or D, rectum. Revealing the correct response in five, four, three, two. I'm so proud of you. You all have that correct. It is D, rectum. So washing from front to back prevents bacteria from the rectum from entering to the urethra, or the hole that you pee out of, and causing infections. And so if you want to see our clinical skills videos, we have a full list of the 21 skills for the Florida Prometric CNA examination. But Prometric does the CNA test for multiple states, not just for Florida. And so you can take what you learn from me, intertwine that with your state's requirements. And I had a student who, she actually sent us a gift. She sent us a gift of coffee, $100, because she was able to pass her test strictly from watching our videos, never stepping foot into a classroom. And that's allowed in Florida. Florida allows you to challenge the CNA test. And here at Florida Train Academy, we help those who want to challenge the test succeed and pass on their first attempt. That's our goal. So if you need to see the skills, just go to our website, fltraining.com, and we have a tab that literally says free CNA clinical skills videos. Question number 25. The order vital signs QID means to record vital signs: A, 4 times per day, B, twice per day, C, morning and evening, or D, once per shift? And Mila, thank you for asking about my mom. She just called, so I just I have to go see her as soon as this video's over. So she's doing great. Thank you for asking. All right, so vital signs QID means what, everybody? And yes, Liz and Evelyn and Sarah, it is A, 4 times a day. So QID is 4 times a day. And from one of our previous questions in this video, QOD is every other day. So start writing those abbreviations down if you don't understand them. Question 25, and we're going all the way to 60, everybody. The nurse aide notices that a client has an open red area on her coccyx that is draining. Coccyx is the tailbone. The nurse aide should A, wash the area with soap and water and apply alcohol. B, ask another nursing assistant to look at it and give his opinion. C, check it again at the same time the next day. Or D, tell the charge nurse so she can check it. Thank you all. Thank you, thank you, thank you. Such great responses. We know that that patient needs attention, so we have to get that nurse in the room. So the answer is D. Any open, red, or draining area should be reported to the charge nurse immediately for proper assessment and care. And so if you're in there doing the bath, finish the bath, pat it lightly. I wouldn't put any soaps or any creams on the area because when the nurse comes in, she'll have to remove all of that. So you would just finish doing your bath, get the patient back settled, maybe leave the patient on their side. And then when you get to washing your hands, making sure the patient's safe, side rails up, call bell in her hand, you would notify the nurse. And when that nurse comes in, because the patient's on their side and you didn't apply any extra cream, she should be able to get a quick assessment and then call the doctor for additional orders. And that's how we work together to help these patients get better. Question 27. A nursing assistant is ambulating a client in the hallway. Suddenly, the client complains of chest pain and shortness of breath. Oh my God. What should you do as the nurse aide? A, walk the client back to his bed immediately. B, get the sphygmomanometer and take the client's blood pressure. C, stay with the client and call for help. D, help the client to the floor and go find a phone to call 911. Whew, this one's hard. What do you do? Chest pain, shortness of breath while they are walking in the hall. And it wasn't hard for any of you because you all chose the right answer, which was C. You can never leave anyone during an emergency. So you're going to stay with this person. But my advice to you is to not keep them standing up because they can get dizzy and fall. So you want to try to assist them to a sitting position. That is not a fall, that is an assist. So you're screaming for help. Help is going to come. You're going to stay with the client to provide reassurance and ensure their safety while calling for immediate medical assistance. And believe me, when your team comes, they're ripping down the hall with a wheelchair or a chair, whatever they have. Put that person in that chair and we get them in their room and in that bed so they can get the proper assessment and medical treatment. Question 28. A client finishes drinking a cup of cold water just as the nurse aide arrives to take his rectal temperature. The nurse aide should A, wait 15 minutes before taking the temperature. B, give the client some warm water to counter the effect of the cold. C, report this to the charge nurse. D, take the client's rectal temperature as planned. So if we're taking someone's rectal temperature, they must be pretty sick. Like, why can't we get an oral temperature on this person? What's going on with them? So you're rarely ever going to be doing oral temperatures on your patients who are not in critical care. So just answer this question just for the sake of answering the question, but know in the real world that is the least likely skill that you're going to be chosen to perform. And if you chose D, you are correct. That water has no effect on a rectal temperature, which is why we do rectal temperatures, because they're not impacted by the environment. If the room is cold, if the room is hot, it doesn't matter. When you go inside and get a core temperature, it is not affected by a cup of water, a cold room, or somebody having too many blankets on. So drinking cold water does not affect rectal temperature readings. And again, the only time you'll be doing a rectal temperature is if you're a patient care tech in an ICU and this patient is hypothermic and we need to get like a core temperature. That's when we do rectal temperatures. Question 29, which of the following observations should be reported immediately? Let's see. A, temperature 98.2, pulse 88, respirations 20. B, yellow colored urine. C, bluish tint to the lips and skin. D, skin that is warm and dry to touch. Which do you report immediately? I see A's, I see D's, I now see a C. And I'll reveal the answer in 5, 4, 3, 2, and yes, bluish lips, fingertips. That is a sign of poor circulation, aka cyanosis. So C is the correct response because that indicates a lack of oxygen, and you'll be getting your nurse in the room immediately if you notice a coloration change on a patient. Lips were previously one color and now you come in and they're bluish. Fingertips also, medical emergency. Question 30. Microorganisms can be spread by direct and indirect contact. An example of indirect contact is A, bathing a patient, B, drawing blood with gloved hands, C, touching objects or dirty instruments, C, touching objects or dirty instruments, or D, breathing dust particles in the air. Which is an example of indirect contact? And I'm doing my nurse happy dance over here. Inoculin, Helena, Danita, Anna K, Mila, Liz, you all have it correct. It is C. All right, and so when you are taking your CNA exam, something as simple as your uniform touching the sink, that would be a way where you can indirectly transfer germs. So indirect contact refers to the transfer of microorganisms from one person to another via a contaminated object, surface, or instrument. Dirty instruments or objects can harbor pathogens that may be transmitted when touched, leading to the spread of infection. So great job. While the other items, the other things we're talking about, drawing the blood, etc. You had on gloves so that you would have not been spreading your contaminants unless you touch those dirty gloves to a different surface. And for that particular question, that wasn't the response given, which is why C was the best choice. Question 31, which statement about hand washing is correct? A, the faucet is clean and may be touched when washing hands. B, wash at least 2 inches above the wrist. C, hands can be washed in any temperature water. D, hand sanitizers never substitute for hand washing. Which of the following is true? So that means there are 3 incorrect choices and only 1 correct choice. Which one is correct? Revealing the answer in 5, 4, 3, 2, and you all, when you wash your hands, you also have to wash your wrist. So the answer is B, wash at least 2 inches above the wrist. And so the water temperature does matter. You don't want scalding water when you're washing your hands. You also don't want cold water. If you have warm water, that is the safest in order to kill and or remove the germs. So washing above your wrist. If you've not watched our hand washing video, of course, you can see our CNA skills video list when you go to our website, fltraining.com. But yes, you have to wash your hands for 20 seconds, including the wrist. And don't forget to clean around the cuticles and beneath the nails. Question 32. The nursing assistant finds a client lying on the floor. The nursing assistant should first A, run out of the room and get help. Well, we know that's not the answer because we can never leave a person alone. Okay. And especially if they're in danger. B, help her into a chair. C, gently shake her and ask if she is okay. D, call 911. And reveal the answer in five, four, three, two, and you all don't call 911. She just may have laid on the floor because she was just chilling. She just wanted to get on the floor. So do a quick assessment first. Hey, are you okay? Like what they teach you in CPR. So the answer is C. Before taking further action, determine if the client is conscious and responsive. Always prioritize assessing the situation. So in like a hospital, it's like simultaneous. You see somebody on the floor, you're hitting those shoulders, you're trying to check for responsiveness to know if you need to be starting CPR before, and also the pulse and respirations before the nurse gets to the room. It may take the nurse a minute to get to you, and we're just not going to look at this person for a whole minute. So you would have to start doing those chest compressions until that nurse gets there. But if the person's talking to you, well, you know that you're still going to call the nurse, but it would be less urgent. You wouldn't be calling a code. You'd be calling for assistance, and that's totally different. Question number 33. And if you've stayed this far and you haven't liked this video or shared, do Nurse Eunice a huge favor and go ahead and like the video, give it a thumbs up, share it. And also, if you haven't subscribed to our channel, make it official and subscribe so you can be notified when we post a new video. All right, so question 33. Which statement about the use of fire extinguishers is correct? A, any fire extinguisher can be used on any fire. B, each extinguisher should be used for the correct type of fire. C, nurse aides are not responsible for using fire extinguishers. Or D, fire extinguishers should not be used for small fires. Which is correct? Revealing the answer in 5, 4, 3, 2, and we're torn between C's and B's on this one. All right, and so you all, it is not C. Nursing assistants are responsible for using fire extinguishers. Yes, you all are. We're going to show you how to do it. We're going to pass, we're going to pull, we're going to aim, we're going to squeeze, and we're going to sweep side to side. So everyone in a facility is taught fire safety, and the correct response is B. Each extinguisher should be used for a correct type of fire. So for example, if you are working in an environment that has, hold on everybody. Hey mommy, it's me. I'll call you as soon as I'm done. I'm in class right now. Okay. All right. I love you. Sorry about that, y'all. I had to answer my mom. All right, so fire extinguishers are classified for the specific types of fire. Example, electrical, grease, chemical. So if you're working in a warehouse, they may have an extinguisher to put out chemicals such as gas. Whereas if you're working in an office, the fire extinguisher is more than likely going to be putting out paper and wood type products. So that is the difference. And that would not be something that you'd be responsible for, really knowing. You just have to know how to use the extinguisher that's within your facility. Question 34. A client begins to choke during feeding. The client is conscious but unable to cough or speak. The nurse aide should A, shake the client and ask if the client's okay. B, call the physician. C, administer abdominal thrust. Or D, sweep one finger in the client's mouth to check for the obstruction. The person is conscious. They have their hands up to their throat, the universal choking sign. They're not able to cough. They're not able to speak. What do you do? And if you chose, yes, Sherlyn, yes, Liz, we're going to do the Heimlich maneuver, but we don't call it the Heimlich maneuver because the family sued and we just can't say their name as much anymore. So the correct term is the abdominal thrust. They are used to dislodge an obstruction in a conscious choking patient or person. Question 35. The nurse aide should tell the licensed nurse if a patient with blank does not finish the food on his tray. A, stroke. B, cancer. C, diabetes. Or D, Alzheimer's disease. The nurse aide should tell the licensed nurse if a patient with blank does not finish the food on the tray. And then Danita took an exam and it had where is supplemental feeding kept in a nursing home facility. Um, Usually if it's like when you say supplemental feeding, Danita, if you're talking about G-tube feedings, usually it's kept in the pantry or the nourishment room. But if you want to email that test question to me so I can see it, I can provide you a better answer. And also let me know what the responses were. But usually the additional supplemental foods are kept in a pantry area where only the staff can access it. So you all for question 35, the correct response is C, diabetes. So if a patient with diabetes does not eat their food, their blood sugars could drop. So it's critical for you to report if the person is not eating. And that will help us maybe provide them with something else to eat, or just a reminder to eat all of their food, or to let us know if they start feeling shaky, because that would be an indication of hypoglycemia. Question 36, which of the following task is not within the job description of a nurse aide? A, providing the resident with ROM, which stands for range of motion. B, shaving the resident. C, applying a sterile dressing to an open wound. Or D, recording vital signs. Which one of those tasks can you not perform? And that is right. A CNA does not perform sterile technique. So you cannot do C. Applying sterile dressings is outside the scope of practice for nurse aides and requires licensed nursing staff, which is why when you work in a hospital, they don't call you a CNA. They change your name. They call you a patient care tech because they may require you to learn how to catheterize somebody. And whenever you're going internally, that requires sterile technique. So as a CNA, you can't do anything heroic. You do the basic stuff, the baths, the boo-boos, and feeding. But when you're in the hospital, they're going to teach you more, but in teaching you more, they change your name because they can't change your scope of practice. So that's why whenever you're applying for a position in the hospital, you usually will not see a position titled nursing assistant. It's going to be titled patient care tech, and it requires a CNA license in most states. All right, question 37. Giving good oral care to a client includes all of the following except A, wearing gloves, B, handling and storing dentures carefully, C, using dental floss, or D, removing oxygen before brushing. And we'll reveal the answer in 5, 4, 3, 2, and I tricked some of you all with this one. It was not C. It is D. Great job, Evelyn. So you all can help floss someone's teeth. You certainly can. What you cannot do is remove their oxygen, you all. That's what's keeping him, for lack of a better term, stable or alive right now. So we don't remove it. We can do blow by. We can maybe unwrap it from around his head and have it in front of his nose while we perform oral care. But if you just take it off to get your task done, he's going to desaturate, which means his oxygen levels are going to drop lower than normal. He has that oxygen on for a reason. You have to work around the oxygen. So oxygen should not be removed without proper authorization, as it may pose a risk to the client. The same goes when you're feeding a patient. If a patient has on oxygen, you can ask the nurse to maybe change it to a nasal cannula versus a mask. Otherwise, you're going to have to hold the oxygen mask up to his face, remove it to give a bite of food, immediately put the oxygen back on his face. That's taxing for you and also for that patient who's trying to breathe and eat at the same time. Question 38, to prevent infection in the client with an indwelling catheter, the nurse aide should A, keep the drainage bag higher than the bladder. B, do perineal care from front to back as needed. C, let the tubing make a U loop below the bed. Or D, do perineal care every other night. Ooh. I think I have the wrong answer for this one. Yeah, I agree with the answers you all are putting in. So if on the next screen it doesn't say the answer you're putting in, Nurse Eunice made a boo-boo. So let's see. 5, 4, three, two, and oh, good, I did it right. You're going to do it as often as needed. The correct response is B. Proper hygiene, including from front to back, prevents infection by avoiding the spread of bacteria to the urethra. Question 39. A client is on a clear fluid diet. The client's lunch tray may consist of which of the following? A, tea, broth, and gelatin. B, coffee, milk, and soup. C, milk, soup, and ice cream. D, coffee, broth, and crackers. So, clear fluid diet. What is allowed? And I'm so proud of you all for taking time to study with me on this Saturday morning. And for question 39, you all, I'm revealing the answer in three, two, and one. This one gets a little tricky, but Jacobus, I hope I pronounced that correctly. You have it. It is A, because gelatin, even though it's in a different state, it's still considered clear liquid. So it wouldn't be soup. They cannot have soup. They could have broth. And then milk is not clear. Coffee is clear if you don't add any cream to it. It wouldn't be ice cream. Ice cream isn't necessarily, it could be a clear liquid, but the fact that they added that milk in there means that that would not be allowable. So that's what makes C incorrect. And then D includes crackers. So gelatin can be given to someone who's on a clear liquid diet. Clear fluids include liquids that are transparent and free form solids. And even though this one says dairy products, if someone is on a clear liquid diet, that means their stomach has been resting. The first thing you give someone after their stomach has been resting would not be milk, because they could be lactose intolerant, and you giving them a dairy product could upset their stomach. So my rationale is incorrect. Just keep it clear until the doctor advances the diet. Question 40. Which statement about injuries to clients and staff members is correct? A, injuries should be treated and reported on the incident report. B, injuries to staff can be ignored if they are minor. C, injuries should be reported only if they are major. D, injuries should be treated but do not need to be reported. And revealing the answer in three, two, and yes, you have to report it, you all. So it's going to be A. All injuries, regardless of severity, should be documented on an incident report for accountability and for follow-up. So let's say it was something that was sticking out and it poked you. And you're like, ouch, well, that hurt it, but you don't let anybody know. So now imagine how many other people are going to be poked by this sharp object that now has your blood on it, someone else's blood on it. So just don't say nothing. Let someone know so we can address it. That's how he prevents slips, falls, and other injuries. Question 41. Lying on a job application is an example of A, tort, B, malpractice, C, fraud, or D, negligence. It's just a little lie. I'm going to tell them I have 5 years of experience instead of telling them the truth that I just graduated yesterday. And so you all, the correct answer for 41 is C. It is fraud. Fraud involves intentional deception to secure unfair or unlawful gain. Question 42. When shaving a client, the nurse aide accidentally nicks the client. What should the nurse aide do? A, put alcohol on the nick. B, report it to the charge nurse. C, report it to the physician. Or D, ignore it since it's just a nick. All right, and revealing the answer in 5, 4, 3, 2, and all right. So here it says report it to the nurse. But before you report it to the nurse, please apply pressure. So apply pressure. Make sure he's not just having some blood draining down from his face. Apply the pressure. Put a little gauze on it, and then maybe put the Band-Aid on it once you walk away to let the nurse be made aware. So any injury, regardless of severity, should be reported to ensure proper care and documentation. Question 43. When witnessing another aide hitting an irritable client, you all, I don't know where it was located, but you all can look it up. It was in some nursing home. 16 employees were arrested, had warrants for neglect and elder abuse. So Um, yeah, it's really serious. So back to 43. When witnessing another nurse aide hitting an irritable client, the nurse aide should A, tell the aide to stop, B, observe the aide for a few days, C, report it to the charge nurse, D, ignore it. The client is irritable. You saw Sally hit Mrs. Marsha. What are you going to do? Revealing the answer in 3, 2, and I am so proud of you all. It is C. And if it was the charge nurse who was hitting the patient, you can always report that to the authorities, to the police, to someone higher than her within your facility. But we are mandatory reporters. So reporting the incident to the charge nurse is a correct action because abuse must be addressed immediately and through proper channels to protect the client and ensure accountability. While option A, tell the nurse aide to stop, seems appropriate in the moment, it does not ensure that the incident will be documented or that further steps will be taken to prevent future harm. Reporting to the charge nurse ensures that the incident is escalated, investigated, and resolved appropriately according to facility policies and regulations. And again, like in the case where like 16 staff members were recently arrested, reporting it in-house sometimes is not enough. You may need to report it to outside authorities if the abuse is that widespread. Question 44. When clients are in a healthcare institution, they can expect their treatment to conform to A, infection control manual, B, patient's bill of rights, C, policy and procedure manual, D, physician's code of ethics. And if this is your first time here, you haven't subscribed, we'd love to have you as one of our subscribers. We try to come on 2 to 3 times a week and help you prepare for your exams. Whether it's CNA, I have a long home health aid video to do. I just got to find the time to actually complete it. That was a video that you all requested. And so my goal would be to have that home health aid video practice test done next week. All right, so you all, the correct response to 44 is B. And I just did a whole video on the patient's bill of rights. So the Bill of Rights outlines the standards of care and respect clients should receive. Question 45. A conversation about a client in the hospital's elevator violates A, the client's right to privacy, B, the client's right to medical care, C, the client's right to review his records, or D, the client's right to ask questions. And we'll reveal the answer in 5, 4, 3, 2, and yes, easy peasy, it is A. And again, I'm not sure why you're getting a delay on your end. If you're on YouTube, maybe sign out and sign back in again, but I do apologize. So everybody, yes, it is A, the client's right to privacy. So discussing client information in public areas violates HIPAA and the privacy rights. A healthcare institution, Mila, it could be a nursing home, it could be a hospital. So it's just anywhere where healthcare is provided. It could be a doctor's office. So that's just a broad term. All right, so question 46. A client constantly makes sexual remarks to staff. The administration decides to instruct staff to call the client by name and tell the client, A, you are making me blush. B, your comments are not acceptable. C, you are quite a character. D, you should be ashamed of yourself. What is the best response when dealing with someone who is making you uncomfortable? Yes, Ong. Yes, Evelyn. You are correct. It is B. Your comments are not acceptable. Squash it. Addressing inappropriate behavior professionally maintains boundaries and respect. And you can be stern and you can still be nice. Mr. Lucas, I do not feel comfortable with what you're saying to me. I need you to address me this way. What you're saying is not appropriate. And for the most part, your patients will fall in line once they understand that you are intolerant of those misbehaviors. Question 47. Which of the 5 senses would be best to detect a rash? Is it the sense of sight, smell, touch, or hearing? And looks like Anarchy and Solange, you all are fast with this one. So revealing the correct response in 3, 2, and it is A, the sense of sight, because rashes are primarily detected visually. A patient may feel it, but you, as a healthcare provider, would see it. Question 48. The best way a nurse aide can clean an infant's eye is with an A, cotton swab lubricated with petroleum jelly, B, moist cloth wiping from the inner to the outer corner, C, alcohol wipe using circular motions, D, hot towel wiping from the outer to the inner corner. And that is right, team. It is B because everything else sounds painful. It's B. So the correct way is we're going to use a moist washcloth with warm, very comfortable water for the baby, not too hot, not too cold. And we're wiping from the inner eye towards the outer tongue. We're always trying to wipe the germs away. So this method is gentle and prevents the spread of infection. All right, so our next question is question 49, and we're going all the way to 60. A client who is hard of hearing repeatedly turns on her light. When responding to the client's call light, regardless of how frustrated you are, how should you respond? A, listen carefully to determine her needs. B, talk loudly over the intercom so that she can hear you. C, train her to use the call light less often. Or D, tell the charge nurse that the client is seeking attention. And revealing the answer in 5, 4, 3, 2, and yes, Jerlyn. Yes, Anna Kay. It is A. I don't care how many times she calls you. You be professional and you're going to listen carefully. Actively addressing the client's concerns, demonstrate empathy and good care. And what I like to do is once I'm in the room and I give them the call bell and I say, let me know if you need anything else, I will be honest with them. So, Mrs. Marie, I'm going to be in another room for probably about 30 minutes. Is there anything that I can get for you before I leave? Because I still have to round on all the other patients. And usually there'll be more understanding if they're calling you constantly, because you can't take care of 15 patients and one person's trying to pretty much dictate all of your time. So be proactive, get them everything they need before you leave the room, and then leave them with the call bell. All right, question 50. Another employee asked the nurse aide, what is wrong with a newly admitted client? What should the nurse aide do? A, tell the employee since this information can be shared. Tell the employee since information can be shared with coworkers. B, discuss the situation with the charge nurse before talking to the other employee. C, wait until break time to discuss the client with the other employee. Or D, tell the other employee that aides are not allowed to talk about the clients. So Miss Nosy, aka Messy CNA, comes to you and is like, hey, what's going on with the new client? If the client was assigned to her, she would know what was going on. So the best response is yes, very politely. Now, Miss Messy, you know I can't tell you anything about that client. So it is D. You're going to protect the client confidentiality. That is mandatory. In some of your facilities, you're going to have celebrities. You're going to have government officials, and you're going to have coworkers from other floors and other units asking you questions about the patient. If you share any information, kiss your license goodbye, and you're probably going to be sued. So you have to keep the patient information confidential, even if it is a coworker that you are familiar with. Question 51. Most hospital stays are A, 1 week, B, a few days, C, 5 days, D, as long as the patient deems necessary. And it is not D, because patients sometimes don't even want to be in the hospital. So as long as they deem necessary, they would just sign out AMA against medical authority right away. Or some patients don't want to leave. They get hot meals, they have wonderful staff, they're getting better care in the hospital than they do at home. So it is not D. What is the next best answer? Reveal any correct response in three, two, and yes, Lily, it is B, a few days. Advances in medicine and insurance policy often result in shorter hospital stays. Look, you don't want to be in a hospital too long anyway, because the longer you're in there with all the germs and all the staff, the more likely you are to contract something. So we need to get you in, get you assessed, and get you home as soon as possible. Question 52. When caring for a female client, how should the nurse aide address her? All right, so are you going to say ma'am, miss? Are you going to call her by her first name or by her surname, which is her last name? And revealing the answer in five, four, three, two, and all right. And I see why you all have like some of the wrong answers. I see a lot of B's because we are just as nice and sweet. But when you're being professional, you have to add something. It just can't be Mrs. It's going to be Miss Jones, whatever is on her chart. So you're going to initially, until she tells you otherwise, it should be D. Addressing clients formally shows respect. And then, Mrs. Jones, I'm Eunice. I'm your CNA today. Do you want to be called by any other name? That's how you can, start that conversation. And that's when you would have permission to maybe call her by her first name instead. Question 53. A client is on a low sodium diet. The nurse aide notes that the client received bacon on the breakfast tray. Yum, yum. The nurse aide should A, remove the bacon from the tray, B, instruct the client not to eat the bacon, C, take the tray to the charge nurse, or D, take the breakfast tray back to the dietitian. What are we thinking, team? Revealing the answer in five, four, three, two, and I think it's Liz. Usually you don't work directly with the dietitian, so you would have to take the breakfast tray to the charge nurse. And you all, I chose an image of somebody running. Because if this patient has bacon, if a diabetic patient has real syrup, you better move fast, because if you leave the tray and say, hey, Mrs. Nancy, Mrs. Jenkins, don't eat that. I'll be right back. Let me go switch out your breakfast tray. They're going to eat it. So, oh, I apologize. It looks like they sent you the wrong tray. Let me cover this up and just take it out the room really fast, and I'll be right back with you a different tray. And then you can notify the nurse, who will then notify dietary. A lot of times they bring up additional trays, but if this patient's on a really, really, really special diet, it may be a few minutes before dietary brings up the correct tray. So move fast, take the tray, and report it to the nurse. Question 54. While providing personal care to a client, the nurse aide should A, uncover the client completely so that she can work quickly. B, uncover only the area she is working on. C, keep the client completely covered and work under the covers. D, leave the curtain open at all times. Well, some of those just don't make any sense. So which one is the one that you would most likely do when providing personal care? And personal care could include bathing, dressing, combing hair, brushing teeth, putting on socks, putting on clothing. So what do you want to do? And if you chose B, you only uncover the part of the body you are working on, you are absolutely correct. That ensures privacy and dignity. Question 55. When providing morning, we call it AM care for the client, the nurse aide should A, let the client do as much as he is able to do. B, do everything for the client so it's done correctly. C, care only for clients who are the same sex. D, work as quickly as possible. Remember what your goal is as a CNA. Your goal is to provide compassionate care and to also help these patients retain their independence. They shouldn't be totally dependent upon you. So the correct response for question 55 is going to be A. Encourage him to help, even if it takes more time. Encouraging independence promotes self-esteem and recovery. Question 56. A client with left-sided weakness should be taught to A, put his right arm into the shirt first, B, put his left arm into the shirt first, C, put both arms in the shirt at the same time, my lord, D, wear a hospital gown to make dressing easier. So when someone has left-sided weakness, what's the best way? What would you tell them in order to help them dress themselves? Revealing the answer in 5, 4, 3, 2, and you are correct. I always start on the weak side. So you're going to do B. Dressing the weaker side first makes the process easier. Question 57. It is important not to shake linens to prevent the spread of what type of microorganisms? Is it A, bacteria, B, fungi, C, rickettsia, I hope that's how you pronounce it, or D, fomites? What are you trying to prevent whenever we tell you, hey, don't shake the linens? What are we preventing the spread of? And revealing that answer in 5, 4, 3, 2, and yes, Amila, yes, Solange, it is A, bacteria. Shaking linens can aerosolize bacteria, which means you put them in the air, spread an infection. So you don't want to shake anything. Question 58. If a client objects to certain food for religious or cultural reasons, the nurse aide should A, tell him to consult with his doctor, B, offer to get something different for him, C, tell him he will have to speak to the dietitian tomorrow, or D, tell him he will be giving a tube feeding if he won't eat. Well, that's just harsh. So we're revealing the answer in 5, 4, 3, 2, and Liz and Mila and Adiola, you have it. It is B. Offer to get him something different. Respecting cultural or religious beliefs foster trust and ensures proper nutrition. Plus, you just made a new friend. The patient's going to love you forever because you looked out for them. Question 59. A terminally ill resident refuses his bath and throws a water basin across the room. Which stage of dying does this behavior represent? A, denial, B, anger, C, bargaining, or D, acceptance? And as a reminder, when someone has accepted the fact that they're dying, that is usually when they would go ahead and consult with hospice, and they would be admitted to the care of hospice. So it doesn't seem like this person is in the acceptance stage. So what stage of grief is this person presenting with? And if you chose B, anger, you are correct. Anger is a common reaction during the grieving process. Question 60, a terminally ill resident begs, please just let me live long enough to see my granddaughter. Which stage of dying does this behavior represent? Is it denial, anger, bargaining, or acceptance? And I see a variation of answers for this one. And so you all, they are bargaining, they are pleading. So it is C. Bargaining is a stage of dying in which the individual attempts to negotiate with God, with the higher power, themselves, family members, staff, in order to extend life to achieve a specific goal before death. You will see patients who will hang on until the last family member comes. And once they see the last family member or the family members leave, that's when they will expire. And so in this scenario, the resident is expressing a desire to live long enough to see the granddaughter, demonstrating a characteristic bargaining behavior. And so you all, we have reached the end of our 60 practice questions. I am so proud of you. Great job, team. And if you weren't here from the beginning, let me remind you that on next Saturday at 6:30 p.m., we're going to have our virtual vision board party right here on YouTube. Get pen, get paper, go ahead and get some art supplies. I want you to be thinking about your goals for 2025. And I want to be the one who helps you not only realize your goals, but to help you achieve those goals. Because a lot of you all have passed and now you're CNAs place, or you're going to be passing your CNA exam soon. What's the next goal? Let's write it out. Let's talk about it. And so you all, as in every one of my videos, I just want to tell you how much I love you. I appreciate you. Thank you all for being our viewers and for subscribing. And if you have any questions, I'm going to stay around for another minute or so, and I'll address those questions in the chat. So if you're leaving, have a wonderful weekend, and I'll see you next week. If you have questions, put them in the chat. Bye, everybody. I am so proud of you. Congratulations. Oh, you all grew up so fast. I think I don't want to mispronounce it, Onaini. Last name is Odilongo. So I'm so proud of you. Congratulations. Let's see. Any other questions? You're so welcome, Jacobus and Melanie. Anna Kay, you're welcome. Sherlyn, you're welcome. All right, so I'll give you about 30 more seconds to put some questions in the chat. And if you don't, I will begin my weekend. Got to go back and check on mom anyway. All right, you all take care, and I'll see you in the next video. Bye.